I'm Dr. Brian Rushaju, dental surgeon from Run Dental Clinic. My dear patients, I want today to discuss with you about the most common dental problems that we have in the world, mainly tooth decay and gum disease. Tooth decay, what we call scientifically dental caries, is basically the dissolution of the tooth material due to accumulation of plaque on the teeth, and this dissolution of calcium ions and other ions lead to cavities, which lead to pain and what causes what we call pulpitis. So mainly our teeth are shaped in such a way that they are not flat. They are not flat on the occlusal surface. They are rugged with pits and fissures. And most of the time, these pits and fissures are irregular, and they can be stagnation points. They can be stagnation areas for food. So when you brush your teeth and you don't brush effectively, or you fail to brush, the food that remains in these pits and fissures, and generally in the mouth, we have oral flora, that's a bacteria in the mouth, that will start eating this food on the teeth, and they produce acids as a byproduct. And these acids will begin to demineralize the tooth by removing mainly calcium ions. And what starts as a spottish, whitish, spottish lesion goes on, if not dealt with, if not treated, goes on and becomes a deep cavity. At first, it is usually localized in the enamel, but sometimes it then goes deeper into the dentin, where you start feeling sensitivity. Sometimes when you take hot things and cold things, you start feeling sensitivity. And if you do not visit the dentist and you do not intervene, then it goes deeper and reaches the pulp, or the toxic substances of the decay reaches the pulp, and then you get pulpitis. The pulp is going to get inflamed, and then you feel pain. And that is a stage where most people run to clinics. And so the tooth decay is very common, affecting very many people in our world today. And we have to prevent this tooth decay by regular cleaning, removing plaque, by not allowing the biofilm in the mouth to accumulate. Because when it is stagnant in some areas, like I've explained, it will lead to tooth decay. So we've got to make sure that we clean, and clean effectively. Now, if I'm talking about cleaning, we of course encourage you to clean your teeth 2 times a day, in the morning and evening. And when you're going to clean your teeth, you just get your toothbrush, if you have an ordinary toothbrush, or you have the automatic brush. The automatic brush, of course, it's just a button away. You just press a button, and it's able to just brush one tooth after another, one tooth after another. it does the brushing, you just move it, and then even inside, you just put on the different teeth, and it will do the brushing for you. But if you have the manual brush, we encourage that you put the brush at this angle, that's 45 degrees to the gum, and you turn the brush going down. So the upper teeth, you brush them while going down. That is in the direction of the gum. You're moving from up going down, so you're turning it. Then the lower teeth, you put the brush in the same way, facing down, and then you turn going up. You brush while going up. And you do that for both in and inside the mouth. And then we encourage that on top of the teeth, that's why you can do this kind of brushing, but not in the sides. Some people brush and then they end up hurting their gums instead of actually encouraging them to cover the teeth, encouraging them to, and they don't clean effectively when you do like this. You only just destroy your gums and expose the cervical areas of your teeth. Now, when we encourage you to first clean the teeth, you may actually use a toothbrush without using water, without using toothpaste at first, so that you remove food off your teeth. Then the second time when your teeth are clean, you can put toothpaste, and you repeat the procedure of brushing. Repeat the procedure of brushing with the toothpaste. And we don't encourage rinsing. You can spit as much as possible, but leave the medicine to work. Leave the fluoride ions in the toothpaste to actually have time to work on your teeth. You can just hold on to rinse. Don't immediately rinse everything and lose the most important thing that you want from the toothpaste. So when you do this, it helps to remove the biofilm or the plaque, the food which is going to accumulate, and bacteria will lack what to eat, and therefore you'll have less acids in your mouth that will destroy your teeth. Now, when we clean our teeth, we don't only benefit from the freshness. Of course, we want you also to remember to brush your tongue, because sometimes the bad bacteria that causes halitosis or bad smell resides on the posterior part of your tongue. So you want to make sure that you've cleaned your tongue as well. But you don't only benefit from the freshness of brushing, you also encourage your gums. You know, you do what we call gingival massage when you're cleaning. So there's increased saturation of blood in your gums become strong, they continue to protect your teeth. Because when gums disappear from your teeth, definitely the exposed part can be sensitive. It is covered by cementum, the root part of your tooth, and that may be sensitive. And so you want to make sure that your gums are actually covering and encouraged to cover your teeth as they were created. And so when you do this, you achieve freshness, you achieve reduced acid in your mouth, and hence you don't get tooth decay. But in case you have tooth decay, sometimes the white spot lesions can actually go away with regular brushing. But there are times when you need now a dentist to be able to make a filling, especially when the enamel has already been destroyed and the cavity is deeper, is reaching the dentine or actually reaching the pulp. So visiting a dentist is something that is recommended so that the dentist can assess how far the cavity has reached. The problem we have is that most of the time patients don't feel pain when the cavity is still in the enamel, in the white part, in the outer part of the tooth. So patients wait for pain, but by the time you get pain, most of the time the cavity is deeper. It's already reached the dentine or the pulp cavity. So it's better to have routine checkups where these problems can be detected, because we have ways of can detect carious lesions clinically, but we can also use x-rays, mainly bite wings, to be able to detect early carious lesions and be able to deal with them decisively. Now, when you've finished brushing your teeth are okay. There are so many other problems that one can have in the mouth that visiting a dentist sometimes helps you to identify them, to be able to know that I have this problem or the other problem. There are many patients who come and their teeth are out of order, and most of the time they come when they are already in the teenage years, maybe even late 20s. But it would have been better sometimes to visit the dentist early, so that with proper examination, model diagnosis and analysis, just like you're seeing this model for a patient, if most of these are taken early and analyzed, we can identify the problems and be able to help solve them when it's still early. But when you come late, sometimes it's too late, or it becomes very expensive to actually rectify some of the problems. So visiting a dentist early helps in early detection of dental problems, not only tooth decay or dental caries or gum disease, but other problems like orthodontic problems where teeth are not well aligned the way they are supposed to be aligned. Because in most cases, due to caries, there are many people who lose their teeth before the time they are supposed to lose their teeth. When that happens, you lose space for the permanent teeth, because most of the male teeth are keeping space for the permanent teeth. So when you lose them early, there is a tendency for the space, for the incoming adult teeth or permanent dentition to occupy the space, but the teeth which come later may fail to get space. And so you find that that can cause malalignment and orthodontic problems. And many other problems, because some can be skeletal, others are dental alveolar. You find that if one is checked early and detected, these problems are detected, then one may have, that may help to solve the problem early. There are others who get lesions on the soft tissues of the mouth. One can get things like upthrust ulcers, some will have, small lesions, even you can have oral candidiasis, there can be, leukoplakia. There are many lesions that can go on the soft tissues of the mouth that if detected early, we'll be able to help treat them when it's still early, and that will help to help because most of them may cause pain and discomfort, and definitely with pain and discomfort you start to dodge food, you don't want to eat certain foods, and so that helps for you to be able, for the quality of life, for you to be able to benefit from all foods. It's better when all these are treated as early as possible. There are, of course, other problems if teeth are not taken care of. We've seen people who keep on taking painkillers. There are medications on the streets where people give you certain drops and they tell you if you put them in the teeth, they'll be okay, they'll work. Yes, most of them are painkillers and they're able to stop the pain, but the destruction of the tooth continues. And what we have seen, you find somebody comes and the crown is totally broken, is completely gone, has been eaten up, but they're not having pain because of these medications that they're able to buy on the streets. Now the problem is that, of course, if you're not careful, the infection can go on and go on, will be in the root system and can be in the periodontium. Most of the time, patients are able to develop a granulation tissue which is able to contain the infection. But in case of reduced immunity or any other problem, this infection can get out of that capsule and be able to spread into the neighboring tissues. When it does that, definitely one can come up with, dental abscess. You can have space infections, and those are dangerous because there are many people who can die out of these space infections. As you know, the face, teeth are not very far from the brain. So if you have retrograde infection, where infection is going back in the drainage, it can lead up to problems like cavernous sinus thrombosis and many other dangerous infections that can actually kill you. So when infection gets out of the teeth and goes to other spaces in the face, like the submandibular space, the canine space, when they get out of the tooth, where the teeth are, they can actually lead to other problems. Then you have other issues where if you've not taken care of your teeth and you've not gone to a dentist, you find that most of these problems, one leads to another. You remove one tooth and teeth begin to move, the other teeth begin to move. If these teeth work together, if you have one tooth, for example, this tooth coming out, there is a tendency for this tooth, the upper one, which works with it, to come out. So it can be extruded from the jaw. So it comes out. It's as if it's looking for its friend. And when it comes out, definitely the part which is exposed, the root part which will be exposed, can be a problem. It can decay easily, but it can also be a point of sensitivity. Then the times when once you remove a tooth, then, for example, if you remove this 3.7, then the 3.6 and the 3.8 tend to close in the gap. And while they're doing that, they're coming together, definitely they will create areas which are like undercuts where you can't clean properly, and then that will be an issue. But sometimes also as they do that, they also come out of the jaw a bit, and that will also create the same problem. So there are also sort of things that can happen. Of course, if you start losing your teeth and you do not replace them, there are other challenges that can come. And these challenges, one leading to another, you find that you're having a difficult situation in the mouth. The dentist is able to usually assess and make a plan for replacement, and if especially the tooth is very, very important, the last teeth, the last molars, where you may ignore and you don't replace because they're not really doing a lot of work. But when you lose the main molars, like the first molars or second molars or the premolars, or the front teeth, which are very important aesthetics, you find you need to replace them. Otherwise, the movement of these teeth or even missing them alone can be a problem to some patients. So I would encourage you to please visit our website, www.rundental.org, or visit our social media platforms at Run Dental Clinic, Facebook, Run Dental at Twitter, and Run Dental Organization at Instagram. Now, we encourage you to send all your questions. I'll be happy to answer them. I'll be happy to be able to give you more information on some of the things that you need. Or if you want to actually physically visit our clinics, you are welcome to clinics. We have one at London Chambers, next to Pioneer Mall, on Johnson Street, Kampala Road, and another one at Akamwes Shopping Mall on Gaza Road, level 2. You're all welcome.